right, so we'll move on to item number 2, presentation by the Director of Emergency Management regarding the status of COVID-19 outbreak.
Good morning, Commissioner. Scott Lewis, Director of Emergency Management. I ask that you permit me a little latitude today. I would like to read a little bit of a report that I prepared. 1 year, it's hard to imagine that on February 20th, 2020, the CDC announced the first person in the United States had died from COVID-19, a man in his 50s who resided in Washington State. Since then, 28 million Americans have been infected and 500,000 have died. It was in March of 2020 that Nye County began to experience the effects of COVID-19, or the novel coronavirus, after our first recorded case occurred in Beatty. Our first death was to be recorded just 2 months later in Pahrump. Over the past year, the easily transmitted and evolving COVID-19 virus has necessitated the largest medical and logistical support response ever utilized in the United States and in Nye County. Whatever the personal beliefs that anyone may have regarding COVID-19, I don't believe that anyone would disagree or have imagined the hefty toll, the price, and the personal sacrifice that Nye County residents have had to undergo this past year. Many of us have either experienced COVID-19 personally or lost or have known people who are either sick or passed away from COVID-related complications. Our emergency services, both volunteer and career, have remained steadfast in their commitment to our communities without disruption during the pandemic and deserve our thanks and recognition. Under a formal unified command structure, Nye County Emergency Management, the Emergency Operations Center, has remained operational under a modified status every day for the past year and has been a steadfast hub of coordination and support. Under declarations of emergency, emergency management became the lead resource in managing multiple aspects of the response, including but not limited to coordination of the continuity of operations planning, contingency planning, continual EOC operations, which is the Emergency Operations Center, and the necessary command structure to support it, internal and external communications through our Public Information Officer, Arnold Knightley, our COVID testing support and personal protective equipment supplies, COVID PPE acquisition, distribution to all Nye County emergency responders throughout the county, COVID tracing and investigations, COVID vaccine acquisition, distribution, and administration, and also grant funding and CARES funding with the cooperation and the teamwork from finance. Our reports completion and records retention is completed on a daily and a regular basis. And over the last year, emergency management has distributed 23,500 masks, 6,350 COVID tests, 227,350 exam gloves, 626 face shields, 325 goggles, 800 Tyvek suits, 785 gallons and gallons of sanitizer in just about every application that you can imagine. We've also facilitated scene lighting and heaters at both vaccination and testing sites. What has this meant to us? We have managed successfully 2,560 Pahrump cases, 70 in Amargosa, 23 in Beatty, 130 Tonopah cases, 29 in Smoky Valley, 4 in Manhattan, and 1 in Gabbs. Our COVID trajectory is improving. We remain in a flag status as I speak, and because of our elevated test positivity rates is 8.7. We are nearing the threshold to take us off flag status, as that threshold is 8%. Our vaccinations. The vaccinations continue well underway. We have 2 pods that are being completed both in Tonopah yesterday and today, and we're doing a massive pod here in Pahrump tomorrow with hopefully between 400 and 600 vaccinations. Other Nye County pods have existed with the Veterans Administration, Desert View Hospital, and our pharmacies. Our vaccines are received in 1 week increase, and we are starting to see those increases come to our tables and into our arms. Additional pods have been held across the county with 1 yesterday, today in Tonopah, as I mentioned. Further pods are scheduled this week in Pahrump, including the Veterans Administration this coming weekend. Pahrump Fire Rescue is assigned to assist in that endeavor and to make sure that our veterans are safe. We also continue to open additional tiers and lanes to get more people vaccinated and are lowering the threshold of the age to 65. A new vaccine from Johnson & Johnson is a single dose with approximately a 70% efficacy rate, is now in our hands. We are going to be addressing target audiences following recommendations of the CDC and state health. Our team consists of Department of Emergency Management, including Aries and Races, Pahrump Valley Fire Rescue, the Nye County Sheriff's Office, who is out there helping us provide security, escorts, and traffic and pedestrian management, Nye County Administration, Immunize Nevada, Battleborn Group, State Health, and a host of other local volunteers who have come out and help us with our pods every week. Our team continues to work tirelessly and without complaint to complete respective COVID-19 missions. I would like to remind everyone on the contacts, nvcovidfighter.com for those that have internet service, and for those that don't, telephone number 775-751-6313 or 800-401-0946. Again, those last four is 0946. End of report, Commissioners. Thank you.